Hi everyone, welcome back to my YouTube channel. Hope you all are doing well. Today I will be talking about 2023 Medicare Advantage and Part D Advance Notice Fact Sheet. Let's get started. On February 2nd of 2022, the Centers for Medicare and Medicaid Services or CMS released the calendar year 2023 advance notice of methodological changes for Medicare Advantage or MA capitation rates and Part C and Part D payment policies. CMS will accept comments on the calendar year 2023 advance notice through Friday, March 4th of 2022 before publishing the final rate announcement by April 4th of 2022. Net payment impact. The expected impact of the proposed policy changes on Medicare Advantage plan payments relative to last year is as follows. Year-to-year percentage change in payment. CMS expects the growth rate to increase by 4.75%. CMS expects 7.98% average change in revenue for Medicare Advantage plans, 3.5% average increase in risk scores, not accounting for normalization and Medicare Advantage coding adjustments. Individual plans experience will vary. 0.54% change in star ratings, 0.81% drop in normalization. No change in Medicare Advantage coding pattern adjustment and risk model revision. Rebasing/repricing impact is dependent on finalization of the average geographic adjustment index and will be available with the publication of the calendar year 2023 rate announcement. 2023 Part C risk adjustment. CMS will continue the calendar year 2022 policy to calculate 100% of the risk score using the 2020 CMS HCC model, which was phased in from calendar year 2020 to calendar year 2022 as required by Section 1853A1I of the Act as amended by the 21st Century Cures Act. CMS is also continuing its policy of calculating risk scores using diagnoses exclusively from Medicare Advantage encounter data submissions and fee-for-service or FFS claims. CMS is soliciting comment on whether enhancements can be made to the CMS HCC risk adjustment model to address the impacts of social determinants of health on beneficiary health status by incorporating additional factors that predict the relative cost of Medicare Advantage enrollees. 2023 End-Stage Renal Disease or ESRD Risk Adjustment. CMS uses a separate model to calculate the risk scores applied in payment for the Part A and Part B benefits provided to beneficiaries in ESRD status when enrolled in Medicare Advantage plans, Program of All-Inclusive Care for the Elderly or PACE organizations, and certain demonstrations including Medicare Medicaid plans or MMPs. In the calendar year 2023 advance notice, CMS is proposing to implement a revised model for payment to Medicare Advantage organizations for enrollees in ESRD status and intend to use the revised model for additional organizations other than PACE. This revised model is calibrated on more recent data using CMS's current approach to identify risk adjustment eligible diagnoses from encounter data records. It also incorporates improvements previously made to the Part C CMS HCC model, specifically the clinical updates and revised segmentation, which account for the differential cost patterns of dual eligible beneficiaries. Program of All-Inclusive Care for the Elderly or PACE Risk Adjustment. For calendar year 2023 payment to PACE organizations, CMS will continue to use the 2017 CMS HCC model to calculate non-ESRD risk scores as CMS has done since calendar year 2020 and the 2019 ESRD models to calculate ESRD risk scores as CMS has done since calendar year 2019. Medicare Advantage coding pattern adjustment. Each year, as required by law, CMS makes an adjustment to plan payments to reflect differences in diagnosis coding between Medicare Advantage organizations and FFS providers. For calendar year 2023, CMS proposes to apply a coding pattern adjustment of 5.9%, which is the minimum adjustment for coding pattern differences required by statute. CMS continually reviews Medicare Advantage coding patterns and continues to assess how they calculate the Medicare Advantage coding pattern adjustment, how best to apply it, and what the appropriate level of the adjustment should be. Medicare Advantage Normalization Factor. CMS calculates normalization factors annually to keep the FFS risk score at the same average level over time. CMS is proposing to use the methodology typically used for calculating the normalization factor, which is to project the payment year risk score using 5 historical years of FFS risk scores under the payment year model. CMS typically uses the most recent years of available FFS risk scores to calculate the trend. However, for calendar year 2023, CMS is proposing not to update the years in the trend because of concerns that the changing use of services in 2020 because of the COVID-19 pandemic resulted in an anomalous 2021 risk score, which will result in a projection that significantly underestimates what the 2023 risk score is likely to be. Instead, CMS is proposing to use the same years of FFS risk scores that were used to calculate the slope for the 2022 normalization factors 2016 through 2020. 2023 Part D Risk Adjustment. For calendar year 2023, CMS proposes to implement an updated version of the RX HCC risk adjustment model used to adjust direct subsidy payments for Part D benefits offered by standalone prescription drug plans or PDPs and Medicare Advantage prescription drug plans or MAPDs. The recalibrated RX HCC model includes a clinical update to the RX HCCs based on ICD-10 CM diagnosis codes rather than ICD-9 CM codes used in the prior models. The recalibrated model also includes an update to the data years using the same approach CMS uses to filter diagnoses from encounter data records for risk score calculation, including the risk adjustment allowable CPT/HCPCS codes. Puerto Rico. The proportion of Medicare beneficiaries who receive benefits through the Medicare Advantage program as opposed to FFS Medicare is far greater in Puerto Rico than in any other state or territory. The policies proposed and under consideration for 2023 would continue to provide stability for the Medicare Advantage program in the Commonwealth and to Puerto Ricans enrolled in Medicare Advantage plans. These policies include basing the Medicare Advantage county rates in Puerto Rico on the relatively higher costs of beneficiaries in FFS who have both Medicare Parts A and B, continuing the statutory interpretation that permits certain counties in Puerto Rico to qualify for an increased quality bonus adjusted benchmark and applying an adjustment to reflect the nationwide propensity of beneficiaries with zero claims. Part C and D star ratings. In the advance notice, CMS provides information and updates in accordance with the star ratings regulations at Title 42, Part 422, Section 164, Section 166, and Part 423, Section 184 and 186. In addition, CMS solicits input on future measures and concepts as CMS continues to advance health equity and enhance the star ratings over time. The advance notice includes information about the date by which plans must submit their request for review of the appeals and complaints measured data, lists the measures included in the Part C and D improvement measures, and the categorical adjustment index for the 2023 star ratings, and lists the states and territories with individual assistance designations that began in 2021 from the nationwide FEMA major disaster declarations used in the definition of an affected contract for the extreme and uncontrollable circumstances adjustment for the 2023 star ratings. Additionally, CMS is soliciting feedback on a number of different potential measurement concepts and methodological enhancements, including the following: plans to enhance current CMS efforts to report stratified Part C and D star ratings measures by social risk factors to help Medicare Advantage and Part D sponsors identify opportunities for improvement. The development of a health equity index as an enhancement to the Part C and D star ratings program to summarize measure level performance by social risk factors into a single score used in developing the overall or summary star rating for a contract. CMS is also soliciting feedback on the development of a measure to assess whether plans are screening their enrollees for health-related social needs such as food, housing, and transportation, and how Medicare Advantage organizations are transforming care and driving quality through value-based models with providers to use in the potential development of a Part C star ratings measure. Comments on the proposal set forth in the advance notice must be submitted by Friday, March 4th, 2022. The final 2023 rate announcement will be published no later than Monday, April 4th of 2022. To submit comments or questions electronically, go to www.regulations.gov, enter the docket number CMS-2022-0021 in the search field, and follow the instructions for submitting a comment. Hope you found this information useful. If you enjoyed watching this video, please consider subscribing to my channel and leave me a few comments. Thank you for watching. Bye now.